We're going to get things started. I'll introduce myself. Everybody can hear me? Like thumbs up for people. Okay, awesome. I'll introduce myself. My name is Marguerite Pierce. I'm one of the co-founders of She Matters, and I will be acting as today's moderator. And to kick things off, before I hand it over to Jade for opening statements, I'd like to just spend a few seconds going over housekeeping items. As you may have noticed, when you were admitted into the meeting, everybody is automatically muted. Right now, we have about 40 participants, and I'm expecting it to go up as the event continues. So it's just best to keep everyone muted. Also, your cameras by default are turned off. Feel free to turn them on if you want to show your face. Um, for the Q&A portion of the event, I ask that you send me, the host, your questions, and I will read them aloud for today's presenters to have an opportunity to respond. I'm putting some crisis hotline information in the chat. The topic of discussion is a very sensitive one, so we ask you to be open and compassionate and flexible with yourself. But if you find that some of the information is triggering and you're feeling overwhelmed, you can reach out to the resources in the chat. And I think that's it for the housekeeping items, and I will turn it over to Jade Kearney to get us started.
Hi, everyone. Good afternoon or good morning, depending on where you are. I'm so happy that so many of you registered, showed interest in She Matters today. Again, my name is Jade Kearney, and I am the founder of She Matters. I decided to start She Matters because while I was navigating through my postpartum wellness journey, I felt like there were a number of things missing. One was community. The other one was resources, and then culturally competent therapists. In our first installment of this 3-part series, I talked about what that felt like from a community standpoint, not really having anyone to talk to or relate to about what I was experiencing, which happens to a lot of Black women during their postpartum wellness journey. Resources, there weren't that many articles that I could, that I found that really spoke to me as a Black woman around the mental, physical, or emotional stressors that happen throughout the postpartum journey. Also, culturally competent therapists. Last week, if you were on, you know that I went through a few therapists to get to the one that I felt best resonated with me and what I was going through as a Black mother. Today, we're going to talk about vitamin D. And I know it's a bit of a shift from last week, but I felt that it was very important to talk about vitamin D because of my experience with the lack of vitamin D throughout my postpartum wellness journey. I like to kind of do it in story form, so I'm going to give you my experiences, the most pivotal experiences throughout my process. So I'll start with what I was experiencing when I was going through postpartum anxiety, OCD physically. So I knew something was wrong because I was very weak. In addition to just feeling down, feeling anxious, and having those intrusive thoughts we talked about last week, and I'll just tell you what intrusive thoughts are. They're unwanted thoughts that keep coming in and out of your mind.
Jade, I can't hear you.
Oh, sorry. I was feeling weak. I was feeling faint at times. I had tingling in different sides of my face. I had tingling in my feet. I had twitching in my feet. And at this point, I didn't know what was going on. I started to think that something was happening to me neurologically. So I started to go to neurologists. I went to several neurologists, and they all said the same thing. Well, it doesn't seem like you have a brain tumor. It doesn't seem like anything's wrong. Maybe you have MS, because some women have MS after it's sparked by childbirth. And so I did some testing there and that came out negative. At this point, I felt like I had nowhere to turn. Like nobody was giving me any answers. I was so frustrated. I was like, I don't feel like myself. I have brain fog. I'm dizzy. When I'm breastfeeding, I feel weak. So I decided to go a different route, and I decided to see an integrative medical professional. So they deal in holistic medicine a bit more. And so they looked at me from the inside out, really. They took a comprehensive blood test, and I found out that on a scale of what I believe is normal is around 40, your vitamin D levels in your body, about 40, mine was 7. So that struck me as like really scary because I didn't understand what is 7, what does 7 mean? It means that I'm vitamin D deficient. And so when I looked at what vitamin D deficiency does, it was all of the symptoms that I was experiencing. And no one had brought that up to me. My doctor didn't bring it up to me. What they did was try to put me on medication immediately. You're going through postpartum anxiety, OCD, you're going through postpartum depression, here's medication. My OBGYN did the same thing. They prescribed a number of SSRIs, but nobody took the time to find out what my levels were. Nobody took the time to figure out maybe this woman has vitamin D deficiency. And that's what I was experiencing. And so I thought it was very important to bring that up because what started to happen for me was I was having all of these physical symptoms and they were starting to mess with me mentally, right? So I started to think, oh my God, something's really wrong. Am I very sick? Nobody can figure it out. Maybe this could be detrimental to me. And it was just playing back into those postpartum intrusive thoughts that I was having, you know? Then I found out through integrative medicine that vitamin D affects your moods. So without the proper levels of vitamin D, you have mood swings. So that's what was happening to me. We're already having mood swings because of our hormonal shifts, but I was having mood swings because I also didn't have vitamin D. So that can go from depression to anxiety. And here I was just in this cloud of not knowing and not understanding my body and the chemistry in my body. And it was making me feel out of control. I called friends and family. Again, I didn't feel like I had a community that could really relate to what I was going through. And so I really reached out to people who I knew were learned in this field and learned in specifically postpartum for Black women. So one person that I reached out to was my aunt. She's on the call and she's going to speak to us. She is a nurse as well as many other things. And she's going to talk to us a little bit about vitamin D. So Marlo?
Okay, can you hear me?
Yes.
Okay, so good morning, everybody. I'm in California, working on a remodel, so there's going to be some noise in the background. I apologize. But as my niece stated, she kept calling me, telling me about these symptoms, and all I kept saying was, well, did your doctor check this? Did your doctor check that? And even I myself didn't even know or think about the vitamin D. I just told her they need to draw everything. They need to look at all your electrolytes. They need to look at everything to see, because she was having these muscle twitching. And so muscle twitching is usually associated with like a calcium deficiency. So I'm telling her there's got to be some type of a vitamin that you're missing. There's got to be something, magnesium, calcium, something that's missing. But we didn't hit the nail with the vitamin D until she went to see that specialist. So with vitamin D deficiency, I'm going to talk about a couple articles also that because there is emerging research on the field. But a vitamin D deficiency, you're going to have subtle kind of symptoms. You're going to be tired. You're going to have like aches and pains, bone aches, muscle aches. But you're also going to have like this fatigue. So with the fatigue, you get up and you do like just a walk and you're like already winded. You feel short of breath. Those kind of symptoms also can precipitate anxiety or panic attacks in people. Especially if you're an asthmatic and you're thinking that you're having like an asthma attack and then you just like resort to your rescue inhaler. Muscle pains, weakness, also difficulty sleeping, early premenopausal symptoms because you get up with these night sweats also. And so those are part of the things which can also lead to some depression. So there's the mood swings and the depression. So about 40% of Americans are actually vitamin D deficient. And it is a known problem because they defortify milk and cereals. So that's where we have to look at also that people of color have some problems with the lactose in those products. So people of color stay away from those defortified foods. So milk is fortified with D, cheeses, yogurts. The other things that are now fortified are tofu. So tofu is a product, soy milk is fortified. In addition to that, we also avoid the sun, right? And so we're not out in the sun and we're using sunscreens. And vitamin D is naturally produced by your skin. So that's why when you have a baby, they talk about, and we teach, you go and you put the baby in the sunlight because it helps. And they also produce vitamin D through the skin. So that's how it's produced. So now we're having to take supplementation. And I have to tell you that I'm not going to encourage anybody to take any supplementation. I'll talk about me for a minute. I am a registered nurse. I'm a specialist. I have my certification in inpatient obstetrics. I also am a committee member for AWON, which is the Association of Women's Health Obstetrics Neonatal Nurses. We work on improving outcomes for women. We look at mortality and morbidity rates. We look at the discrepancies in the healthcare that is provided to different people of different races and different socioeconomic statuses. We work with CMQCC and CPQCC on all the projects related to postpartum hemorrhage, preeclampsia, why some people are more predisposed to those conditions. So all of this falls into that genre of the things that we are looking at. Vitamin D deficiency is one of the leading causes of osteoporosis, heart disease, diabetes. It's linked to autoimmune disorders. It is linked to hypertension. It is linked to poor pregnancy outcomes and infertility. So that is one of the things that they test for. If someone comes in with repetitive infertility issues, they just can't get pregnant. It's associated with polycystic ovarian disease, also with depression, asthma, and psoriasis and skin conditions, which is something that a lot of people don't know about. In addition to that, I did some research and found a couple articles where they have found in recent research that was conducted in 2019 that the level of vitamin D in the system seems to be decreasing with increased skin color. So the darker skin color, the more vitamin D deficient the person is. And it has something to do with the melanin in the skin also that is not producing enough vitamin D. I looked up something also to encourage people as far as foods are concerned. There are foods that can help that increase your vitamin D, fish being the #1 product. We're talking about salmon, trout, herring, sardines, tilapia, even canned tuna, eating mushrooms. Orange juice is now fortified with vitamin D also. So they've started fortifying orange juice because so many people do not drink milk. Pork chop and ribs. I found that to be kind of an interesting fact. And then the cereals and eggs, but in particular, it's the egg yolk. And we have a lot of issues with high cholesterol. And so we're concerned with, eating eggs and those things that we shouldn't eat because of the cholesterol. But cholesterol actually helps with the binding of vitamin D in the body. So there's still a lot of research that needs to be done in order to come to some kind of understanding. Now, as an OB provider, I'm going to tell you that when you go to get your prenatal check and your prenatal exam, so we're going to zoom in on pregnancy, we don't do a vitamin D level on pregnant women. You go in and you do your prenatal panel. Your prenatal panel is your type-in screen. So we're looking at your blood type. We're looking at whether or not you've been exposed to syphilis. We're looking at whether or not you have been exposed to HIV or any hepatitis. And then those are the only things that we're looking for. We're looking at your red blood cells because we're concerned with the anemia. We're giving iron supplementation And that's another thing. We just hand out the pill and say, here, take it. Take these multivitamins. Here, you could take some folic acid. That'll help for the baby's neurological development. But there's no explanation either behind that as to the why. And there might be people on the call who are healthcare providers, and I'm not trying to antagonize anybody, but as a healthcare system, physicians fail their patients because they don't explain these things. They just hand out a pill without really explaining. And maybe we'll have another topic and we'll talk about postpartum hemorrhaging, because a lot of that is also associated with the preeclampsia and then the iron deficiency. But back to the vitamin D. There are some studies also related to white counterparts. So looking at women, and we're talking about women of older ages, osteoporosis is associated mostly in a higher incidence with white women. So they fall, they break their hips, their bones fracture, they're taking osteoporosis injections. But Black women don't have those similar problems in the same percentage rate, although Black women have a lower vitamin D level. So there is some kind of a paradox that exists, and there's some research ongoing about that right now in order to understand how it could be that with lower vitamin D levels, your bones are being protected, where other people whose vitamin D levels are always in that so-called normal range have osteoporosis and osteoporotic problems. In addition to that, I think there was another article that was related to factors of depression. So when they're looking at the vitamin D and the supplementation, the depression is also related to your age. There are women that are suffering from postpartum depression because of their age, their socioeconomic status, their other comorbidities, the family support, the community that they do or do not have, isolation because they've come home with a new baby and they might be away from their mother or, the women that are the strong women in their family that are their leaders that could help them nurture and take care of this new baby. And along with having this vitamin D deficiency, not knowing that they have it, not getting good sleep, being fatigued, those are all the things that can lead to serious postpartum depression issues.
Thank you so much, Marlo. So I just want to highlight on a couple things she said. When we talk to our healthcare providers, we often say, like, I'm feeling really tired. I think, I know I said that. I don't know if any of you, other women said, I'm tired. And they said, well, that's to be expected. You have a new baby. You're going to be tired, right? But that actually it wasn't just because I was a new mom and I wasn't sleeping. It was because I had this lack of vitamin D. And that's why we're trying to give you guys the tools so that you can say to your OBGYN, your primary care, can you please check my vitamin D levels? Because having a baby and being a mother doesn't have to be this exhausted, complex thing that you feel like you're alone in. And so we're trying to give you the tools so that you can walk in and kind of take control of what's happening to you physically and mentally. And with that, I'm gonna go over here. I'm gonna turn it over to Colette, Dr. Colette Poole, and see if she would say a few things about the mental aspects of vitamin D.
Hi, everybody. Dr. Coco here. So I'm an adult and a child psychiatrist. Last week we spoke about postpartum depression. I do want to address like how you speak to your doctor. So you don't always have to have the answer. I don't want you guys to feel like if you don't walk into the doctor's office and with a list of labs that need to be drawn, that you're gonna be like SOL or anything like that. What the language that you can use that would signify to your doctor that there's an issue is you can say there is a change in my whatever. So yes, I am tired, but this is different than my usual feeling of exhaustion or fatigue. It's been this many days. This is the character, the character of how I'm feeling. So I want you to know, even if you don't know the labs that need to be drawn, you can say those kind of things to let them know that there's a change from your baseline, that there's a change from normal. Because if you don't give that wording, sometimes they'll automatically, because people have, sometimes we only have like 15 minutes or 30 minutes for an appointment, and you have to kind of like speed it along. So if you can go in there with a clear issue and a clear goal. I feel tired, this is a change from normal, and I want more energy, how can you help me? That would help them to help you. Now, as far as vitamin D is concerned, vitamin D is one of the things that I may draw or get a lab slip for if I have a patient with depression. There are other things as well. So Jade specifically had like a vitamin D deficiency. Some people have like a thyroid problem, and the thyroid can really you'll feel cold, and I'm gaining weight, and my skin, it feels this way. There's like a conglomerate, like a bunch of different symptoms that you may be feeling. So I get TSH, which is going to tell me what the thyroid is doing. Sometimes I get vitamin D, depends on what the patient tells me in their history. Of course, I'm gonna get like labs and electrolytes. I want to know what your sodium level, potassium level, all that stuff is doing. Sometimes I'll get iron level, because some people can't sleep, and then if you dig a little bit deeper, they'll tell you that they're kicking their legs, like, oh my gosh, okay, restless leg, let me check your iron level. So there are multiple labs that we can draw, but specifically vitamin D has been implicated in like seasonal depression disorder. So that's when when there's less sun, you feel more down, your mood is lower. It's also been implicated in just straight depression. But there was a study, I think in 2016, that showed that a lot of patients who were diagnosed with like depression, schizophrenia, who ended up on an inpatient psychiatric ward, actually had really, really low levels of vitamin D. These are very easy things to correct. So that's why it's important for you kind of to know your status in these things, because these all contribute to a greater issue, right? So if you're already having change, you just had a baby, you're having these hormonal changes, you're having all the psychological changes, and then the social changes that come along with having a baby, to add some issues. It's like, okay, now I have a problem with vitamin D. So we correct the easy things, so that the other things that are more difficult to correct, that you'll have more energy to address those things. I kind of was all over the place, because that's kind of how it is in psychiatry. Last week I let you know that when I see a patient, I break them down into 3 things: the biological, the psychological, and the social aspect. And today we're just talking about vitamin D, which is in the biological aspect. But I wanted you guys to know that there are other things that can be going on biologically that is affecting your mood or contributing to anxiety, or your thinking issues, or feeling fatigued. I don't know, I hope that was helpful.
It was very helpful on this end. Colette was also another person that I spoke to throughout my process. And I really want you guys to understand that this was not an overnight thing for me. My journey was actually a journey. I didn't feel better in 2 months. I didn't feel better in 3 months. I didn't feel better in 8 months. I felt better, I think about around 18 months postpartum is when I really started to kind of feel more like myself. So I want to give you tools so that you know that this is not a sprint. This is a marathon to your wellness. You will go through things, and there will be pit stops on the way, and you'll say, oh, maybe it's vitamin D. Maybe it's my thyroid. Maybe it's my community structure at home. Maybe it's my therapist. But these are all things that can help you get well. With that, Marge, I think we can open up the Q&A.
Okay. Okay, great. Yeah, we have a couple of questions. I think the first question, someone asked if we can provide the research citations, and yes, we can do that after the event. So the first few questions have to do with vitamin D. So Marlo, I'll read this one for you. Um, how does natural vitamin D from the sun differ from supplements and fortified foods?
So the supplementation and fortified foods have to be absorbed through the gut. So there are issues with that also. So once it's absorbed in the gut and it's taken up into the bloodstream, it is processed through the kidney. Your parathyroid gland also has some part in the metabolism of it and absorption. There has to be calcium available in order for the uptake into like the bones, and then for like neurological processes, again, it's being transported through your blood. So when you're talking about natural sunlight, it's not the amount of sunlight to where you're going to get burned. So there has to be some understanding that you go out into the sun and you kind of sunbathe. And we're all concerned about the UV rays and cancer. So if we put a block on, then our skin is not able to absorb those UV rays the same way in order to have your skin produce the vitamin D. The other thing is like the amount of adipose tissue that you have also, it hinders the absorption of the vitamin D through the skin. So there's a lot of multiple factors. The best thing to do is that if you're having these symptoms, and have the conversation with your physician, have them check your vitamin D level, and then supplementation. It also responsibly, they have to give you a prescription for a vitamin D supplementation. You have to know when is the best time to take it. So the best time to take it would be with a meal, like right before a meal. And then also going back for serum levels to be checked. So the serum levels get checked about once every 6 to 8 weeks, because that's how long it will take for there to be a significant difference in the bloodstream for the physician to be able to pick it up and then tell you whether or not you continue with the supplementation. I also wanted to make a note about that too, because I'm not encouraging anybody to run out to the store. I would be irresponsible as a healthcare provider to encourage anybody to like run to the store and buy, you know, vitamin D supplements and start taking them. You really need to be careful, because you can take too much vitamin D, and there are side effects related to that too, with weight loss occurs, anorexia, which is not having an appetite. So you lose your appetite, you become anorexic, and then you also have like a polyuria symptoms, which is also like associated with diabetes, where you just have this frequency of urination and you urinate a lot. And the reason is because your kidneys are filtering your blood, trying to get rid of that. So whenever you take anything in excess, your kidneys go into overworking because they're trying to clean out the bloodstream. So those are other symptoms. And it also, like the calcium and the vitamin D have been associated with increase in kidney stones. So again, I'm not encouraging anybody to go run out and get supplementation. It's about having that conversation, that crucial, I call it a crucial conversation with your provider. These are my symptoms. This is not normal for me. I didn't feel like this before. And can we check my vitamin levels? Can we check my hormone levels? Can we check my electrolytes? And that way we have that conversation.
Great. The follow-up.
Can I just add something really quickly? So
Absolutely.
when you're trying to get vitamin D from the sun, I want to let you know that it's pretty much virtually impossible to get as much vitamin D from the sun that you need. You have to literally be like almost naked and then laid out in the sun for a specific amount of time. You cannot have clothing on that's going to block the penetration. And as Marlo was saying, like the like adipose tissue, which is fat, you know, everybody has differing levels of that. So to get it from the sun is difficult as well. So don't think that you're just gonna like lay outside, you know, and get it. You literally, like I said, you literally have to be like pretty much naked and then laid out for several hours in order to get the sunlight you need. So like back in the day, hundreds of years ago, when we're out working in the fields and people are, hunting, gathering, whatever, you could do that. We can't do that now. It's not really practical. So just letting you know that.
No, thanks for that follow-up. Follow-up question was, does low vitamin D have an impact on the baby if I'm breastfeeding? That's either for Dr. Collette or Marlo for you guys to chime in.
Dr. Collette, did you want to touch on that? There's some research included. Let me find. I have the articles too, and I'll be able to give those and provide the stats. But depressive, it's just associated with the depressive symptoms. It says that there are unfavorable outcomes for mothers and their babies because it's been associated with cognitive development, behavioral outcomes, and mental and physical health in children also. And then I think that part of that just kind of rings true, not being too old school, but, like when you cry, your children cry. Like when you're sad, your children are sad. So there is just this association too, because your children are so bonded to you that they are affected by you and your mood also.
No, thank you for that.
Right. And then also the baby is always going to get what they need from you. So when you were pregnant, these little alien babies are going to take whatever nutrients they need. So that means you will go lacking before the baby goes lacking. But then how that affects the baby is if you are deficient in things and then you feel bad, then you're not going to be caring for the child as you should. And then that will have a negative impact. So it will secondarily affect the baby. So just remember, the baby is going to take what they need from you. So that's why you need to make sure that you have proper nutrition and things, because you don't want to come out of the pregnancy experience in a deficit. Like for me, I never had cavities until I got pregnant. After I got pregnant, I went to the dentist, and the dentist like, your kids did a number on your teeth, because I was pregnant back to back for 2 years. They'll take everything, and if you're not replenishing that, then your body will suffer.
I wanted to add something to that, and this is to all my vegans on the call. I was vegan during my breastfeeding period, and that didn't go so well for me. And my aunt Marlo was like, you have to eat some meat. You got to eat something, even if it's once every 2 weeks. And I was like, no, I'm vegan. It really, really helped me, even the bone broth. So that was something that I tried. I went to holistic doctors. I went to acupuncturists. And when I went to the acupuncturist, they just piggybacked right on what Marlo said and said, you have to have some type of meat because your electrolytes are depleted and you're not going to get it anywhere else. And they suggested bone broth. And I believe Marguerite also drank bone broth after during and postpartum. So I know that we have what we believe are our diets, and I am not asking anyone who's vegan or vegetarian not to eat meat. I'm telling you, I was vegan and I had to, because I literally had no energy. So I just wanted to add that. Go ahead, March.
Okay, we have a few more coming in, so keep them coming. How soon after delivery should I be concerned about vitamin D levels?
Honestly, this shouldn't be I don't want any of you to go away from this talk being afraid and fearing for your life. You're even if you're vitamin D deficient, you are not going to die. You're going to be fine. You just make a doctor's appointment, and the next time you get a checkup, have them, if you're concerned about your vitamin D level, if you're having some of the symptoms that Jade or Marlo talked about, then bring it up. So this is not something that you need to run and figure out right now. Something that would be bigger would be, as Marlo talked about, the postpartum hemorrhage. Like if you're hemorrhaging, that's a problem. Not so much this vitamin D level. That should just be on a list of things to do and check out when you get a chance to.
Okay. Is the next question is there a link between vitamin D deficiency and low blood platelet counts, specifically during pregnancy?
So I'm going to answer that one because I did not see any research associated with it, but vitamin D deficiency is associated with cardiovascular diseases and high blood pressure and increase in blood clotting. So as far as the correlation with low platelets, that is not associated at this time. It's not in the articles that I read. But again, there's still a lot of research that needs to be done on this particular topic.
Thank you, Marlo. Jade, this question is for you. When you were during the intro, and I think you just mentioned acupuncturist, but what other types of specialists or holistic practitioners did you see that were helpful?
Girl, so I don't know who asked that, but everybody on this call who knows me knows that I saw everybody, okay? I went to the Ayurvedic specialist, and let me tell you, she was wonderful. So that's Indian medicine. They don't even take your blood. She knew I was vitamin D by just looking at my tongue. And she gave me herbs there. I've been doing acupuncture for 7 years. I did acupuncture during my pregnancy and after postpartum for 1 year. So with the acupuncture, they didn't give me herbs. They just focused on doing acupuncture in the office. I did some acupressure, which is like if you're afraid of needles, they touch those same meridian points that help balance your chi, just with your energy. They do it without needles. I'm also certified in Ayurvedic medicine, and I feel like the Ayurveda really helped me. And this is something that I wanted to say, and thank you for that question. The Ayurvedic practitioner spoke to me specifically about the vitamin D and not being able to absorb it because of my gut function. So Marlo touched on that, but if your gut is compromised, like if you have a leaky gut or if your nutrition is not well, you won't be able to absorb the vitamins in your body, and you'll just have expensive pee. So like you'll urinate and it'll be all the vitamins that you're spending all your good money on coming out. So you need to make sure that your gut function is well. And me personally, I like to go to Ayurvedic specialists, and I like to go to acupuncturist with my labs from the Western doctor. So let me check over here. I'm not dying. Let me take it over here for my maintenance.
Thank you. Thank you. Okay, we've got some more. Hang on. Okay, so we have in response to you being vegan, Jade, we have a question from vegetarians. Are there other ways to get vitamins? Funny because while I was pregnant, I craved meat and would eat cheeseburgers. So, so I don't know, Marlo or Dr. Collette, any advice or suggestions for vegetarians on how to increase their vitamin intake?
So I think Jade
Oh, go
should
ahead.
answer that one. This is Marlo. I think Jade should answer that one because at one point, I think she said that to me. She was like, Titi, I just want to eat some meat. And I was like, because your body's craving it, because it needs it. But
the first thing that I did was eat a mozzarella ball. I'm not even gonna front. Like that's what I did. Like the cravings were so real that I just ate cheese the first 2 weeks, and I hadn't eaten cheese in 6 years, but that's what I needed to do. Like I was like near tears. So I ate the cheese, but after the baby was born, I would get vitamin D shots, and this is something you can talk to your healthcare provider or your holistic providers. So now what I do, because I don't eat meat, now what I do is I go and get a vitamin D shot. It's about 5,000 milligrams. You cannot get it in the store. Again, you have to check your labs because they're not going to just give you vitamin D if you're sufficient and you're not deficient. But once you know that, you can get it in a shot form once a week until your labs are better. So I think the thing that you can do, get the shot, start eating. I think strawberries have a lot of vitamin D. I love strawberries. And there are a couple other fruits that have vitamin D in them. Oh,
So,
mushrooms.
so yeah. So I was a vegetarian in college, and when I was pregnant, I wanted a steak so bad. I don't know why or how, but I needed a steak, and I hadn't had a steak in years because I stopped eating red meat in high school. But I don't know what it was, but I ended up eating the steak. So the thing is, your body is gonna know what it needs. It's gonna tell you what to do. These bodies have been like it's in our genetic material. Like for those of us who have had children, remember that urge to push that came, like when it was like finally ready, like nobody had to tell you what to do. Your body told you, like, girl, it's time. And then you felt the urge to push. And the same thing, like whatever it is you needed, your body is telling you, I can get it from a steak. That's how smart our bodies are. Now, it's not just vitamin D that we could be craving. Some of us are deficient in iron, and then some of us are deficient in calcium. So there are other things that our body just intrinsically knows, like, once I get this steak, I'm going to get the level that I need. So you have to figure out what that deficit is. And if you are kind of like, no, I'm not going to eat this steak and I don't want to eat the cheeseburger or whatever, you have to like figure out what it is that's going to take away the craving for you. So some people, you have to like try different snacks, or like try brown rice or different types of potatoes to see what takes away that feeling. And then again, talk to your doctor to see where you are deficient, because it's not just vitamin D that's causing these cravings.
Yeah, no, I have my own craving story during pregnancy. Like I'm completely like lactose intolerant, and this was like before I even found out I was pregnant. I wanted milk, like whole milk, like it and drink glasses of it and in cereal, and that's just something I typically didn't do. Like I avoided, and that's was a good clue that something was up. Something was up. Um, Let's see. I think we got through all of the questions, and I think we did that in just amount of time. Okay, any recommendations for items that are high in vitamin D and iron? I think those things that you just listed, Dr. Collette. Yeah, okay, go ahead, Jade.
Marlo just sent me something that I will email out to everyone on the call. It's about it's different things that you can eat, drink to help you increase vitamin D.
Okay.
I also wanted to add something really quickly. So I experienced hair loss, and it's hard to tell if you have hair loss, if you have shrinkage. Let me show you. It's my heritage here. But I did experience hair loss, and that's a sign of low vitamin D. It's also a sign of like the thyroid thing. You'll experience some hair loss, the postpartum hair loss. But that's how I knew. And I couldn't really tell because usually I have a bald head. But when I started growing my hair back, I noticed that it was much thinner postpartum than beforehand.
Yep.
So some people are saying things in the chat. Maybe you want to.
Yeah, I mean, like a lot of people are just echoing, some of the comments that have been made. I think since we have just a few minutes left, I'll just prep everybody for. Yep, go ahead,
Wait,
Dr.
so
Collette.
I just saw what somebody said. I didn't know. Okay, so I had chunks of hair come out when I washed my hair last night, and I'm 6 months postpartum. So this is, okay, remember biopsychosocial, the biological part. So when you were pregnant, you had an increase of certain hormones, which increased your hair growth. And then so once you are not pregnant anymore, your body is not supporting that anymore. And then sometimes you have the hair loss. Sometimes you don't actually usually go into a deficit. You just lose that fullness that you were getting in pregnancy. So that's exactly what's going on probably with you 6 months postpartum.
Okay, and then we have a question on preeclampsia.
Can I say something?
Yep.
I had preeclampsia. Okay.
Me
Lord,
too.
I know. And Black women have preeclampsia disproportionately than other women. A lot of us, and I'm saying this from the most not humbling, but sincere place, this needs to be addressed because a lot of us are dying on the table, and it really hurts my heart. And when I say Black women, I mean the race of Black women, Afro-Latinas. We are all experiencing preeclampsia. For me, I changed doctors, and this will be a whole series. So we'll have a 3-part preeclampsia because that's more than an hour, right? I changed doctors at 27 weeks. My doctor was a Black woman, but she kept pushing that I would have preeclampsia, and I didn't have it yet. She would say, your blood pressure's high. Well, my blood pressure's high because every time I come in this office, you telling me my blood pressure is going to be high. So what do you think? I was uncomfortable in her office. So I really didn't have preeclampsia until 38 weeks. They called me. I went in the doctor's office. They said, what's that test, Marlo, where they take your urine?
Yeah, it's a 24-hour urine that we do for protein and creatinine clearance.
Yeah.
And so it's a function of your kidneys too, because as your blood pressure increases, the blood flow doesn't circulate. So like your kidneys cannot filter the blood 100% if the blood pressure is high, because the pressure is too high and it bypasses part of that filtration system.
So that's what happened to me. So like they took my 24-hour urine sample. They said it had gone up 200% from my baseline. They called me in. They said, let's take your blood pressure. It was 151/90, and they walked my ass across the street to the hospital. So I think that preeclampsia also contributes to postpartum anxiety and depression, because everything that you thought in that moment about your birthing plan and your experience is changed in 1 second. And it's like, this is life or death. We need to make sure that baby comes out, and no one thinks about how you feel. Now, I had a wonderful birthing experience, but I had a doula. I had a doctor I trusted, and I went in the office and I said, look, I know the numbers for preeclampsia and I don't want to die. So he already knew who he was dealing with. I had a great hospital. And through my doula, I was able to create a space. And when I was delivering, that was calm. I didn't want to hear the beeps. I didn't want to know if my blood pressure was going out of control. I didn't want to know all of that. I just wanted to be in the present. But I really had a hard time with being told I had preeclampsia before I had it. So we will do an event series about preeclampsia, because it did change my birthing experience. It did make me scared. It was a conversation with my doula, but through my doula, through my support system, Colette, Auntie, I was able to manage. But that's why we have She Matters, because everybody doesn't have the same supports. And I want to make sure that if you are postpartum and you have preeclampsia and you're having depression and your blood pressure's high, that you have somebody to talk to, and you have a tribe, and you have a community that you can converse with that about. That's all I want to say.
Yep. No, perfect. So thank you to everyone who was able to join and commune with us. We have the third part of our series is kicking off next Saturday, same time from 1 to 2. Registration for that event opens at 2:00. Everyone that's on the call will receive an email that has the link to the registration for event number 3. I think I got through all the questions. I'll hand it back over to Jay to close us out.
Thanks, Marge.
Yeah.
So I just want to say, this is the second part of this, and I am so humbled by my best friend, who is my co-founder, Marguerite Pierce, one of my best friends from high school, Dr. Colette Poole, Titi, Marlo. These are the women who helped me get through, or who are helping me, because this is a journey, right? Who are helping me through this process. So through community resources and culturally competent therapists, we're here for you. I'm gonna ask you, the audience, for a few things. One thing, I'm gonna ask that you complete the surveys, because we wanna make sure that we are getting what we need, so that we can be that community that you need, so that we can serve you. In order to do that, we need testimonials, we need information about you. Also, we would like if you could send us a video about your postpartum experience. I think it's important for people to hear from Black women and what they're experiencing, because I think it's ignored completely. And like I said, we're dying 12 months out. If you're in Texas, God bless you, because I know what your postpartum experience has been through research. And I just want to make sure that our voices are heard, regardless of where She Matters goes. You guys deserve to be heard. So please, if you would like to share a video experience, you'll get an email, and you can email us at info@shematters.io. You're going to get a survey. Please complete that survey because it matters. Now, we're virtual now, given the circumstances that we're all in, and I hope that all of your families are safe and that you are all safe. But this is just the first part. So community doesn't stop here, start or stop here. It's much bigger than this. And we can't do this without you guys. I am so appreciative, and I can't wait to see you guys next week.
Okay, everyone, just be on the lookout for emails from us and stay connected. You can follow us on Facebook and Instagram just to stay in touch. So thank you so much, everyone. Enjoy the rest of your day.